Welcome back. All month long, we are highlighting breast cancer awareness right here on WPBF 25. And one pillar in our community has been helping women with breast cancer since 2018. And it's the Promise Fund of Florida. Here to talk about the organization, Nancy Brinker, the founder of this nonprofit. Thank you for being with us. And for those who don't know, tell us your personal connection when it comes to breast cancer.
Well, my sister was Susan Komen and died in 1980 of breast cancer, and made me promise that I would do all I could to find the root of the disease and then make sure people had access to care. A few years later, I developed the disease after I'd started the organization and led it for 38 years. And now, coming home to my own community here in Palm Beach County, find that we have 80 to 100,000 women with no primary health care.
Just crazy.
And honestly, the greatest factor, the greatest way we have to fight late-stage disease is to screen early. It's still the best way to know when a disease is developing.
But when you have that many people, that means they're not getting that early detection.
That's right.
They're not going in for that annual mammogram.
Right. That's right. And it becomes very expensive if they develop a disease when it can be ablated. In most cases, it's a 90 to 95% cure rate.
Sure. And so that's where the Promise Fund comes in, started 5 years ago. And that's where you guys are helping the underinsured, the uninsured right here.
That's right. And we have a wonderful group of people working with us, a great board, and all the time we're rolling out projects. And Breast Cancer Awareness Month has been a time we've been able to tell people what we do and help us grow. The services we provide with our federally qualified healthcare center, Found Care, are at no cost to the patient. So they have, for the first time, a medical home when they go there, and we're thrilled about it. We have probably close to 25,000 patients, women, we have engaged since the time when we began, or actually a little later. But the second we opened our clinic, established our model, got it funded privately, we ended up, now we've been given funds by 3 of our congresswomen to create 3 centers, replicated centers from what our original center is at Found Care.
And so I know there's still a great need, but since the 80s, when you made that promise to your sister, what changes have you seen? I mean, things have gotten, the promise of getting better and the treatment, it has grown, but you still want to see more.
My sister was still whispering the words breast cancer as she was dying. And that's how slow sometimes things go. People are afraid to talk about it. But ever since we grew the Komen Foundation, and then now applying what we know, that's what we call it. We know screening works, and we know treatment, a path for the patient, an empowerment for the patient, navigators right with them, by their side. These are amazing women, somewhere between social workers and clinicians, and know very well what they're doing. And so it's a model of healthcare which you will see now is going to be introduced in the new Medicare resolutions, so that navigational services can be included in Medicare. This is a huge step forward in our country.
That's wonderful.
I'm very proud of the Bidens for leading it, and also their program, the Moonshot program, that we work closely with as well.
Fighting cancer, And so really quickly, as we wrap up this interview, someone watching right now saying, I simply can't afford it, I can't do it. What can they do right now to make sure that they can go and get a screening and not have to worry about what it costs?
They can go to thepromisefund.org, the Promise Fund, or the promisefundoflorida.org. And in our website, it will navigate the patient, and there will be a number to call, and we set up this basic relationship, and then they are brought to their center where they can go to have a screening, and then we can get them on the path of primary care, because they can get other services at a federally qualified healthcare center.
I've said all month when we've done these interviews, there is not an excuse when it comes to getting that early screening. And money is definitely not an excuse, because you guys can make it happen. Nancy Brinker, thank you for being with here. Thanks for all you've done for here in our community, around the state and around the country when it comes to breast cancer awareness and finding a cure.
Let me thank you all. You have been supportive from the very beginning. This wonderful Channel 25. We appreciate it. Anytime you can bring us on, we're there to communicate, to help. We're going to have a healthier community as the next days, months, and years roll out.
Well, we definitely all have a connection, unfortunately, to breast cancer, so I know it means a lot. Thank you for being here. All right, for more information and that website she was talking about, it's on ours, WPBF.com.